Welcome to the Lovers Lounge podcast, where we talk to experts and other guests on topics related to love, relationships, and sex. I am your host, Tina Love, and on this episode, I'm going to be talking to Dr. Adam Matthews. He is owner of Matthews Counseling. He is an American Association of Marriage and Family Therapist clinical fellow and supervisor. And he is the former co-host on Foreplay, Radio Sex Therapy with Laurie Watson. Hello, Dr. Matthews. Welcome to the show.
Hi, Tina. I'm so glad to be here. Thanks for having me.
I know this is I don't know. This is new for me doing this show. I've only been
Yeah,
doing it since the beginning of the new year. So
awesome.
I'm pretty excited to be able to have our
Yeah,
listeners hear you
yeah,
talk about different.
absolutely.
Yeah. So, first off, before we get into the nitty gritty of our interview, I'd like you to tell me a little bit about Matthews Counseling and what you
Yeah,
offer and what you do with couples and maybe even individuals.
yeah, for sure. We see both, but we have a group practice. I have about 8 therapists that work for me, 6 to 8 therapists that work for me, and we are in Cary, North Carolina, and with our couples, our main goal is just that they have a relationship unlike anything that they've ever known before, that it's something that they've always dreamed about. I think really we kind of say that we try to help couples kind of escape the ordinary everyday marriage and relationship and try to move them into something that is just something that is still work. All relationships are work, but something that they're just excited and passionate about. And we do that in our office, but then we also do it um, online as well. We do online sessions as well. But we still, one of the things that we are excited about is that we have over the last year just really ramped up our couples intensive program,
Right.
where we take couples over 3 days in private one-on-one therapy for 12 hours over 3 days. And we've just seen some amazing results from that. And something I'm really excited about that's a little bit different than traditional couples therapy, but it is something that they come in feeling really hopeless about where their relationship has gotten stuck, and they leave really hopeful for the future. And it's just an exciting thing that we're seeing.
Awesome.
So yeah, we're really excited about that.
That sounds really, really good. So, and I even noticed on your website where you had couples to maybe fill out a questionnaire or a survey. I guess you do that as a way of kind of assessing where they are in their relationship before they come to you to get help.
Oh yeah, yeah. For our intensives, they go through I think it's 480 something questionnaire and an assessment that really helps it's a research really grounded in research of couples therapy. It's one that Dr. John Gottman created and the Gottman Institute created, and it's in depth, and it really helps our therapists kind of really pinpoint where our
Yeah.
couples are getting stuck. And so when they come in, we already have a really good idea of like kind of where to go and what's going to be the most effective. And it really kind of has it's just really kind of zeroing in on where we can get the most bang for our clients' buck and for their time. And I think it's really effective.
Yeah. I'd say I saw your website and noticed the couples and their testimonials. And, it looks like you're really, really doing a good job. So I would say probably oftentimes you run into couples that may, for whatever reason, experience issues or blockages in their sexual relationship. And so,
Yeah.
what are some of the reasons that you think this kind of thing occurs? I mean, I guess people have kids. What do you think?
Yeah, I mean, every couple. I mean, I'll tell you kind of the general thing that happens. Every couple is different, so there's some specifics that go into it. But in general, what happens in their sexual relationship is a lot of what happens in their emotional relationship as well. Is that they get into this pattern of being with each other that just gets them stuck. In the beginning of a relationship, I mean, I'm sure the beginning
Right.
of the relationship is usually the best part, right? Well, we feel like it's the best part. Everything's new, and we're doing all the right things in the beginning um, that we don't even know that we're doing, right? And typically, you start off dating, and the passion is there, and the
Yeah.
the attraction is super high, and so And you're doing all these things like spending time together, being curious about each other, trying to get to know each other, trying new things, experimenting, right?
Right, right, right.
In the very beginning of that relationship, and so there's all those things that you're doing naturally without even thinking about it, and then over time, like life just kind of gets in the way. Things happen. We get kids, we get mortgage payments,
Right,
we get more and more pets, we get
right.
bigger responsibilities in our jobs, and life just moves hectic, or like physical stuff starts to happen. And so all of those things start to take away from those things that we did naturally in the beginning of the relationship. And the pattern that we get caught up in is one that just is really hard to break.
Yeah,
It's just hard, like, and it starts to feel like it's the other person's fault. Either he wants sex too much, or she doesn't want sex enough, and honestly, that can be reversed in genders as well. Like
yeah.
like somebody's too sexual, or somebody's not sexual enough, or we're both just ignoring each other, and that it just becomes a pattern that becomes really hard to break.
Yeah. I can remember I had a pastor like years ago, and he was a therapist also. And so he would do like
Hmm.
marriage therapy, and he would talk about how, every child that you have, adds a different level of complexity
Oh,
to a marriage and
yeah,
to a relationship. And so yeah, I can
yeah,
definitely remember
yeah, for
that.
sure.
Yeah, yeah. And then I
Yeah.
was
So,
also listening to some of your podcasts that you did when you were working with Laurie, and you
mhm.
talked about how work can oftentimes really throw us for a loop. Men maybe
Oh, yeah.
having a hard time on their job, and so then they get so engrossed in that, and how that kind of filters into the marriage where we kind of get
Oh, yeah.
disconnected. Can you kind of talk a little bit more about that?
Yeah, for sure. Like, I mean, I think work a lot of times, um, especially in the culture that we live in, there's a high priority that gets placed on work. And there's very specific kind of work pressure and work stress that comes. For men, I think the work stress comes in with their families. It comes a lot from this idea that we're culturally taught that we about that the role that we play in the family is the provider, and whether we can kind of are able to kind of move past that idea in our minds, like just culturally, that's still the predominant message that men get, that they have to be the provider. So that's where they put a lot of their energy and a lot of their effort, especially after the relationship becomes more committed. Where they feel like, and when you start adding kids, then that just pressure just mounts to be able
Yeah.
to provide some security. I think for women, a lot of times, the pressure is a little bit different, but the pressure is then to kind of have this idea of having it all, of being able to have a fulfilling career, and be able to be mom and wife and all those things that come with it. And so that tension between those two, I honestly think women probably navigate it a bit better. But there's that tension that exists there. And so any of those stressors that happen outside of the bedroom are going to come into the bedroom at some point if you're not careful.
Right.
The tension for work, especially if it's going to pull your priority away, it's going to kind of, we talked about kind of pulling the gaze away from your spouse or partner. And so I think it just sneaks in that way, and it's so tricky because the vast majority of people have to work to pay the bills, and so it's not something you can necessarily escape. But it does tend to draw your eye away from the other, and that priority is so key in relationships.
Right.
That the other person feels like a priority, both emotionally and sexually as well.
Yeah. So when couples come into you and they're experiencing this, I mean, I'm sure there's
Hmm.
just a lot of emotion going on. You got two
Oh
people
yeah,
who, because of all of this, are just really probably surprised that they are in the position that they're in, totally
oh
disconnected
yeah,
from each other. And you've got somebody's folding their arms and they're pouting, and somebody's jaws are tight. They're all mad.
yeah, yeah, yeah.
So how do you go about talking to them? Like, how do you go about giving them therapy, and about how long does it really take to kind of see things turn around?
Oh yeah, well, like yeah, you're absolutely right. I mean, they come in. I don't think anybody starts off their relationship right going, I hope we end up in couples therapy
Yeah,
someday.
yeah, nobody.
And I think maybe they, everybody should go, we need to end up in couples therapy for our relationship. But that's my opinion and my bias a little bit. But I think when a couple comes in, the first thing we're trying to do is to try to get them to stop blaming each other for what's going on. The vast majority of people come in and they go, if only the other person would change, then everything would be okay in our relationship.
Yeah.
If only, only he would give more effort. If only she would, get off my case. If only, he would, pick up his underwear off the floor. If only she would squeeze the toothpaste from the bottom instead of from the middle like a crazy person. Like all of those things that they what from the silly to the serious, like we try to stop them from blaming each
Yeah,
other,
yeah.
and to blame that, what I thought about that pattern. We call it the dance. Dr. Sue Johnson calls it the demon dance
Yeah,
between the
the
couple, right?
couples. Yeah,
That and blame that rather than blaming each other.
yeah,
And
yeah,
that's really the first step, because then they can start to work together. And then the second step is really for them to try to understand the other person's perspective. Everything that we do in relationship is kind of driven from some kind of need that we have that's deep and understandable and relatable, right? To the other person. It's just how we can't oftentimes communicate that clearly. It
yeah,
becomes about taking out the trash or how often you're working or how our sex life is going, rather than coming up from the need that we have, and being able to understand the other person's position, and then try to validate that need, and then we work together on how can we accept each other and how can we then begin to communicate better, and create a deeper connection going forward.
right.
So that's kind of what we try. That's what we try to do. In summary, that's a big 30,000 foot view. It looks it's so much easier to talk about, than it is to actually do with a couple. So
Right. So generally, like, I guess it's hard to say about how long this kind of takes with couples because,
uh,
everybody's different, I would imagine. But what do you think? Just
yeah,
approximately?
so approximately, I would say anywhere from if they're going to do traditional weekly sessions, it's anywhere from um, uh, 12 to 20 sessions and
Yeah.
that's if people are able to kind of really get out of that blame cycle really fast. The intensive, cuts that time in half, by the way. Like the research shows that if you do a couple and an intensive therapy of 2 to 3 days, you're going to cut your time in therapy in half and
Wow.
save a whole lot of money. But that amount of time, um, it's contingent. It really is contingent on people how quickly they can stop blaming the other person. I have several couples who have been in therapy for over a year, and probably the vast majority of that time has just been us trying to get them to stop blaming each
So
other. But
yeah.
my couples that do, they're going to get out much quicker and they're going to make progress much faster.
Right. Stopping them from saying, no, it's
Yeah,
you. No, it's you.
yeah, that's right. That's right.
Yeah.
That's
So,
right. Yeah.
so additionally, with all of this, and I think you kind of mentioned it while you were talking,
Yeah.
is the issue of the fact that there comes a time when the marriage becomes sexless. Like,
Yeah.
and then if you, I don't know, if one of your questions is, during your therapy sessions, well, when's the last time that you guys have been intimate or had sex and whatnot?
Mhm.
And then they can, gosh, I would imagine, some of them are like scratching their head, trying to figure it out, because
Yeah.
it's been so long. Um,
Yeah.
so, how do you kind of help them come back together then as far as their sex life?
Yeah. I think it's very similar to the answer before, but I'll make it a little more specific here. It is that dance that you get in with sex, the demon dance that often happens with sex, is that one person is really kind of what we call the pursuer in the sexual relationship. They are the ones that initiate. They're the ones that are the loudest complainers about not having enough sex or not having it often enough or not experimenting enough with their sex life. Um, and the other person is kind of typically, and this is general, not always, but typically they are more of a sexual withdrawer, meaning that they are more the brake on the sexual relationship. The pursuer is typically like the accelerator, and the other person is the brake. And
Yeah.
that's one of the things Lori talks about a lot, is just that dynamic. And so the withdrawer in the sexual relationship, um, is the one that's just slowing things down. That they are typically, their complaint might typically be, well, if you would just spend more time with me, then, or help out more around the house, or want to be around me, be more engaged in what I'm doing, ask me more questions. If you would just do that, I would be more willing to have sex with
Mm-hmm.
you. And so that dynamic, oftentimes the um, the sexual pursuer oftentimes gets labeled as the pervert, and the sex in the relationship, and the or some form of that, and the withdrawer would oftentimes get labeled a prude. And so, like, getting out of that, and again, trying to understand that for the pursuer, like the sexual pursuer, their needs are not just about getting off. Basically,
Mm-hmm.
what they're asking for underneath all of that is typically not a. It's not a. I just wanted to have sex for sex sake, but that's what it feels like to the withdrawer. That's what it feels like that they're saying. And so, getting them to talk more about how sex for them is typically more connecting, and
Yes,
more
yes.
about the person and themselves, and about the relationship. That's how they feel safe in the relationship, is through sex. And then um, helping the other person understand that the person that is the withdrawer, that looks like the prude, is not really the prude. They want sex. It's just not in the same way that pursuer wants sex. It's not the prime. Typically, it's not the primary way that person connects. If it looks like they're being prudish, it's typically saying they feel connected, they feel safe in the relationship in a different way than the sexual pursuer.
Yeah.
And so, like, getting out of that, demon dance sexually becomes the avenue forward. And when you start to do that, solutions start to present themselves a lot faster, as far as how to solve that and how to step toward each other in that.
Okay. Yeah. And so just
That
being
makes sense.
on.
That's a lot of information. I know. I just realized I was rambling on there a little bit.
No, 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 it's
Hope
okay.
that makes sense.
But no, that's good. I mean, it really kind of helps to break down, both sides and how they're looking at it.
Mm-hmm.
And,
Yeah.
so I guess for me, I want to get to something, and I know it's pretty delicate, and some
Sure.
women will probably, if they were around me right now, they would throw tomatoes at me. Um,
Fresh ones, I hope.
yeah, but I'm gonna go ahead. I'm gonna do this,
Okay, do it.
Adam. I'm gonna do this. Like
Yeah, do
this
it.
is
Do
this
it.
is. Whew, I'm gonna put my big girl
Okay.
panties on right now. And I'm gonna
Okay.
enter. I'm gonna enter into something that probably is going to be very controversial for some.
Okay.
There are some
Yeah.
women that will like this conversation, and then there are some women that will absolutely despise this conversation and wish I had never brought it up. Um,
Yeah.
Speaking of, having different sides of views on sex and their needs.
Good.
So, men like fellatio, right?
They do. Yes.
So can you just kind of break down, because I know there are some I've heard of, people, friends, just ladies in general that they're just not really eager to do that. They just
Sure.
really don't want to do that. In fact, I hear a lot of times jokes of women go, well, that's only on special occasions, honey. That's, maybe his birthday and Christmas or something like that. Um, but it's pretty important to the man to have this
Mm.
done to him from his spouse or loving partner. So, can you kind of share why it's so important to men to have this?
Yeah. And I will do my best. I think I appreciate you kind of being delicate about it. I think it is, because I understand that especially from women's perspective, because I think, let me just say, I think men do a horrible job with communicating their need for this, and so it sounds, I think it comes off a lot of times as very barbaric and demanding, and so it's going to, like, I can get why, most women would be put off by it, for sure. I think though that like when and these are things like men will rarely, the things I'll talk about why it's important. I don't know that men will verbalize very often, but when I've talked to men about this, they all start shaking their heads and saying, yes, that
What
is
they
what it
want.
is,
Yeah.
what they want. Yeah, I mean, like, it is something that is, and I'll say, caveat, like if as long as their women are open to it, like if they're gonna ask for it, they've got to be willing to give it as well. They've got to be able to give oral sex if they want to receive it.
Okay.
But the thing that I would say that why it matters so much to men is that, first of all, it like having oral sex, receiving oral sex for men is just it is about the feeling of being deeply accepted.
Mm.
It is a vulnerability. It is something that it's and again, not trying to be crude, but say like his whole world is between her teeth at that moment. Like it's
Wow.
a very vulnerable state
Okay. Right. Right. I
for a
get it.
man.
Yeah.
And so it literally takes him out of his head, pun intended. And it is
Mm.
just, it's mind clearing. Like you talked about that work stress earlier, all of that goes out the window. And he, in that moment, is just deeply, deeply accepted, by his partner. And so it's an acceptance thing. And it is something to have somebody, be willing to do that, especially in a committed relationship. It's the ultimate act of acceptance of this person. Um, and so the second thing I would say is that it is also a a deep sense of connecting. Like for the vast majority of men, um, that it is. I mean, you can't deny. I mean, sex is pleasurable. It's energizing. It rejuvenates us. But at the heart and the core of it, it connects us to our partner. And so it is about that connecting feeling. And intercourse does this as well. But there's a difference when it comes to oral sex. When it comes to fellatio, like it is just it's an even deeper connection. Because
Mm.
again, you think about that acceptance piece, and then there's this like sense of deep connection that happens through that. And so there's nothing like intercourse is good, but it's not. There is a sense of she is fully accepting him, and
Mm.
she is looking to connect with him in that. Um, and the third thing I would tell you is that there is a deep sense of being respected in that as
Mm.
well. And it's
Okay.
not from like a subservient type of way, but it is a feeling of being admired. It's that deep admiration, as in
Mm.
I I really respect who you are, what you do, how you show up in the world. And it's that like there's a stat that I love is that in a survey of men, 70% of men said that they would rather feel respected than
Yeah.
loved,
Right.
if they couldn't have both of them, if
Isn't
they
that
had to
something?
choose between the two.
Yeah.
Yeah, it's kind of amazing. And so this really giving selfless act on the part of a partner is just something that increases um, that feeling of being respected.
And
And so
admired.
all
Yeah.
those things,
Yeah.
yeah, admired. Yeah, it's just that deep admiration. So all of those things combined is that up to like, getting a blowjob from your spouse is just amazing. And
Yeah.
like, on top of that, obviously it feels great. So we
Right. Right. Right.
you can't deny that. But so I mean, but that's the part that's hard. Um, that there's one article that I was reading a while ago that they asked men why they like blowjobs, and like the 2/3 of them had a hard time articulating it.
Right.
It's very hard to put words to exactly why, besides it just feels great. So yeah, so I think that
Yeah.
all of that put together like goes into it, and when you kind of break it down like that, it starts to make a little more sense to me, I think.
Right. Now, do you often hear from women in your practice, maybe as you're doing couples therapy and they're talking about this? And do you hear why the woman is reluctant, or what are the hangups? Like, what is it that
Mm.
uh, that makes them not really want to do this? That they're just uncomfortable. That they would just do anything
Yeah.
else but that. So, what are some of those reasons? Have you heard?
Yeah. I mean, I think it. Um, there's a lot of things that I think go into it. There's some common ones. I think one of the common ones is just our conceptions about sex and about oral sex in general that you grow up with, and what you hear, and the specific pressures that women feel. I think there's this, what do you call it, a kind of this idea that's put out there that's imposed on women, that if they enjoy oral sex, or if they give oral sex, that it's more of a dirty thing.
Okay.
That it's more. I think it's in some ways slut shaming. Like, it's that idea that they are easy if they give oral sex. And so I think that there's that I think goes into it. All the other things that maybe you were raised uh, raised about with sex that are real kind of inhibiting. Um, I think there's some women that have just had a bad experience with that.
Right.
Like, there's, I mean, trauma things that have happened in the past that would inhibit that, which make total sense,
Yeah.
that are any kind of sexual assault or sexual abuse a lot of times involves oral sex.
Right.
And so I think men have to be really sensitive to that. And I think that then there's a section of women that may just not feel very proficient at it, and not know really what to do or how to do it, or how to derive pleasure from it for themselves. And so I think that's a whole section as well,
Yeah.
that makes it just difficult to get their minds around about how this would be um, enjoyable for them as well. That wouldn't be putting them in a position. I mean, they're in a vulnerable position as well, in performing oral sex. So I think it just makes it hard. And then there are men that are just like, it makes the way they talk about it, it makes it communicates to the woman that it's just about getting off, and that it could be anybody down there, and they would be happy about
Yeah.
that. And that I think has got to change as well.
Yeah, yeah, and I'm really glad that you were able to really share those three reasons why it's important. Because, I mean, I'm a female. I would say that that was news to me. That level of deep thought about why it's so important. Because, I'm thinking that it's just for purely the whole pleasure thing. You know what I mean? But the admiration and the respect and all of that, as you broke that down, I mean, that was just really interesting, and a different perspective and a different way,
Yeah.
of looking at it. So, but as you were also answering my question that I just asked about, why women maybe have this hang up, um, you were talking about the fact that maybe they just don't feel like they're very proficient at it. And that's where you come in on this
Okay.
episode.
Awesome. Okay.
Now we're going to move a little deeper. So the thing is, I'm pretty sure I probably have women listening, and they're going, now, I just know she is not getting ready to have him tell me how to do this. Um, but you're a good person to tell us how to do this, because you're a man
Okay.
and you know what men like.
Yeah.
And, I'm sure you've had this done. So, anyway, you can share with us how we should go about doing it for this woman who doesn't feel very comfortable, and she doesn't feel like she's very proficient at it. And she gets down there and she's just like, I don't really know what to do. I'm just going to do
Yeah.
something. So,
Yeah.
let's start. Can you kind of help us with what feels good? How about, let's start there. What
Yeah.
what can a woman do,
Okay.
and how can she do it that's going to feel good for the man as she is doing fellatio?
Yeah. Okay. Yeah. So there's a couple things that I think I would just start with saying, like, one, enthusiasm goes a long way.
Okay.
And so if you don't want to give one, he doesn't want you to 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 do it either.
Right.
If you're just super resistant to it. So what feels good is somebody that really, first of all, just wants to share in that way with you.
Right. So,
Um, and so that, I mean, and I know that that kind of can be hard. It's not an enthusiasm like, and I would say it's not an enthusiasm for the blowjob itself. It is enthusiasm for the person,
right.
right? That you're enthusiastic for him, and for helping him feel pleasure. I think the other thing that also is going to feel good is using a lot of lubrication, like so spit, like just like getting it. It needs to be able to be smooth in that area as well. Like, but you can also use your hand, like often what can feel good is just using a hand between your mouth and the shaft of his penis, like and using that as well, so that when you get tired, you can also use your hand as well. And there's a couple of things that the you can stimulate at the same time. You can stimulate his perineum, which is located between his anus and his balls. And
Yes.
by like gently massaging them while you're going down, that is going to feel super good as well, and going to be really helpful as that. And then there is like at the most sensitive part of the penis is the head or the glands or the lower the edge of that as well. And so stimulating that with your lips or tongue and that's what we call the frenulum, like that is gonna, which connects the foreskin to the glands, like that has a lot of nerve endings, which makes it really sensitive, but it's also gonna be the place that's really good to lick or to gently suck on, and like that is really gonna be feel pleasurable as well. Um, but then um, the the combination really of tongue, lips, inside your mouth, your throat, with your hands, like that whole combination, like it is just going to be highly stimulating and highly pleasurable. Um, and um, and so it's just working there to stimulate it. Um, it's not a how do I say this?
Go ahead.
I think a lot of people would call it as just sucking somebody off, and that's not literally just sucking down there. It's not going to feel really good.
Okay.
It's going to be this combination of all of those things that we talked about that's going to make it something that is really pleasurable.
Right. I was just
Um,
thinking, I'm thinking, okay, so is it really that this person is sucking? Or
yeah,
is there really something else that can go on that feels even better or just
yeah,
as good, or that you don't have to just sit there and, you know, suck until your lips fall
yeah.
off or your tongue. But
That's right.
you know what I'm
That's right.
saying. So
Yeah.
there's some
No,
other
I do.
things.
Yeah.
Yeah. Yeah.
Yeah, I mean, I think just that combination of of being creative and and listening to your partner too, what feels good to him, and what you can do, playing with his testicles, like that.
Yeah, let's get
That's
into
what I think that.
the testicle
Yeah.
thing,
Okay.
playing with it. Okay, so is
Yeah.
it just playing with it with your hands, and or
Uh-huh.
should you lick that or suck that also? I don't know. I'm just asking.
Yeah. 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 That, I mean, that would, both of those things. Yes.
Okay.
Right. And I mean, you're gentle, but taking his balls into your mouth is going to be really pleasurable. Again, be careful in all of this. Like, watch your teeth. Like that,
Okay.
you kind of want to be careful with your teeth as well, because that's going to be painful.
Yeah.
And so you just kind of got to be careful with that. But yeah, like that, being able to with his testicles, like take them gently into the mouth, in your mouth, lick on them, suck them just very gently. Playing with them with your hands is really kind of like a gentle, very gentle massage thing, or just cupping them. And so that aspect of it, anything like that
Be good.
is going to feel
Oh,
good and be
okay.
helpful.
So now, Adam, there's
Yes.
probably women. Well, I know the men are jumping up and down as they're listening to this. They're just like, this is like,
Yeah.
go at them. Uh, but at any rate,
Yeah.
but there could be women listening that are like, what? say what now?
Yeah.
Did he just say put his testicles in my mouth?
Yeah.
So, because testicles have hair on them.
Yeah.
So, is there preparation, or is there something that maybe the man can do to kind of prepare for that?
Oh
Because I
yeah.
can
They
see
need
where
a
there
they
could
need a
be some
manscape,
women
baby.
that, yeah, I could see where some women are like, no, I'm not putting no hairy balls in my mouth. So can you just kind of share that, please?
Yeah, I mean, I will say that there are some people that do enjoy that,
Okay.
that enjoy it, and if you do, there's nothing wrong with that.
Right.
If you don't, like, that's something to let your partner know, and he will, like, if you tell him he needs to shave and he needs to manscape down there, he will go do that in a heartbeat. I promise. He will rush out the door and get. There are several trims. There's some good trimmers out there right now that are that'll get really close, that won't hurt, won't cut. That's one of the biggest fears about that. But yeah, I mean, like you, like they can, trim up down there, manscape
Yeah.
it up,
Yeah.
clean it up. Um,
And they'll
then
be glad to do that. Yeah.
they will be glad to do that. But that's just a communication thing. Going, listen, like this is what I would enjoy. This is what I don't think I can do,
Right.
and working your way toward that. And I would say that, like, too, like, um, any step toward any of these things that we talked about. Like, I can tell that even in my conversation, I'm giving a lot of information,
Yeah.
but any step toward this area is going to be hugely rewarding, in the relationship. And men have got to accept it. They can't keep demanding more. They
Right.
can talk about what they need and what they want, but any step in this
Yeah.
direction
Yeah.
is just going to be hugely beneficial, as far as like all those things of that deeply connecting, deeply admiring and respecting. Like all of those things that we talked about are gonna go. Any
A
step in
long
that
way.
direction is going to be helpful. Yeah,
Yeah.
gonna go
Yeah.
a long way.
Baby steps, baby steps, baby steps. And then,
Yeah,
you never know, you're there.
yeah,
Um, so I know that you mentioned, because I listened to the Foreplay
yeah,
show,
yeah,
about prostate massage.
yeah,
So while you're doing this now, or while you're not doing this, I don't know, but can you
yeah,
just kind of share that a little bit? What that
yeah.
is,
I
what
mean,
that entails, how that works.
yeah, I mean, some men are going to enjoy that, and some men are, not, and so that's something to just communicate in that as well.
To know. Mhm.
But any kind of, like, again, this is gentle pressure. It's not, something, that, you kind of want to just rush, or, um, go all out, like, as strong as you can. Like, it's gentle, massage, and I think that is, again, that's something to really, think through and talk about with your partner, because that in that way, um, um, that is, um, it's an area where when you massage it, it can help them to orgasm,
Okay.
right? And, it has to be, it's, the prostate is located about 2 inches inside the rectum, between the rectum and the penis. And like when, um, going in through there, I mean, the anus is the most direct way, but you can also stimulate the prostate indirectly through the perineum, like that's that area between
Talking
the
about
balls
earlier. Yeah.
and your anus. Yeah,
Mhm.
we talked about that.
Yeah.
And so it's something that either inside or out can be massaged, and it's in it. And when it is, the orgasm can be richer and fuller, right? And from the inside, it feels like a fleshy bulb of tissue on the front wall of the rectal lining. And so it's going to feel different than any other tissue in there. But it can be really intense, and, not everybody, will necessarily feel that there's a percentage of men that can, orgasm through stimulation of the prostate, directly in that way. But not all men can, and so that's the part where you have to kind of, um, walk through it with your partner and see if that's something that they enjoy.
Right. So it's another thing that you
and
kind of
it
have to,
feels good to them.
yeah,
Yeah.
communicate with the partner or your spouse about, and kind of, you know, play it by ear, kind of like
Yeah.
touch and feel and say and whatever. Um,
Yeah.
so something else, I guess I want to
Sure.
go back to, because you talked about how important it is with the saliva and all this.
Hmm.
Um, can you use lube along with saliva? And might that make this a better experience for some women? Because, there are some women that are, I would say, probably concerned about taste or something.
Yeah.
So would
Yeah.
that help? I'm trying to help some sisters
Sure.
out here right now.
Yeah. Yeah. Yeah.
Okay, Adam, I'm
Yeah. I
just trying
mean,
to break it
there
down.
is. I got to.
Okay.
I mean, I think there is. I believe there is flavored lube, and so that's edible, and so I mean, there's anything that you can, or using any other kind of foods that feel good would be helpful as well, but it might be enjoyable. But yeah, I mean that the thing about that is that um, you can use lube. I mean, for most people, as far as just the lubrication element of it, their saliva in their mouth is going to be enough.
Okay.
But they just don't like help like being able to kind of start with maybe your tongue and licking around the shaft of the penis and over the head like that's gonna help that. You just don't want like with it's if the penis is dry, like it's not gonna feel good.
Right.
And so anything you can do there to help that
Yeah.
um, is going to be useful.
Okay. So now I want to go a little further here. And I
Sure.
know listeners are probably saying, What? Go further? Like, what? Is there something else?" Um, but no, I did hear your interview before with Laurie, and I just want to ask about this.
Yeah. Sure.
So the issue of taking this all in, or
Yeah.
that, and how important, or you know how this feels. So can you just kind of explain about that? What I mean by that, just in case somebody's out there going, "What? What is she talking about?"
It's about taking it like all like so.
Yeah.
Are you talking about like deep throating him?
Yes.
Like
Yes.
in the
Yes.
is that what you're
Yes.
talking
Yes.
about? Okay.
Because I understand
Yeah.
that's important and feels good to some and whatever. Yeah.
Yes. I mean, I think it is, but I would also say that it's not everything.
Okay.
Like, I mean, it would like, I mean, there's going to be limitations as far as like how big he is versus um, the how her ability to
Right.
kind of like deep like that aspect of like deep throating is it doesn't necessarily happen right away.
Right.
Like the part of it is if you can, that's great. Like that is a that's something. Again, it really is a gift to him, and it's kind of really it goes back to that vulnerability and being able to again take him all in. It is. I mean, that's a good way to say it because that is it's physical, but then it's also metaphorical for being able to fully accept, fully like kind of embrace him in that moment.
Mm-hmm.
If you can't, right, the next best thing is, and it's still really good. Again, it goes back to that what we talked about putting your like taking as much of them in as you can, and then using your hand the rest of the way.
Okay.
Right. Again, it really is this metaphor for him, his person, and who he is,
Right.
and so having all of it wrapped up in some way in that moment, all of it consumed somehow in that moment, is um, is just this kind of beautiful symbiotic thing between two partners of
Yeah.
saying, "I fully accept you. I can accept and take all of you."
Okay.
And so like that part of it, again, like it's not going to work perfectly for everybody. So again, any part of this that you're doing is really just again, it's a gift to him. It is it is more about him than the act of the fellatio itself.
Right.
Is the best
Yeah.
thing I would say
Yeah.
about it.
And when you're doing this, I mean, there's some precautions also to probably take when you're doing this, because
Mhm.
you're probably reaching your gagular reflux sort
Yeah,
of
gag
thing,
reflex.
right?
Yeah,
Yeah.
Yeah.
So
Um,
you have to be careful about that. Are there any other tips that you might want to be careful about as you may perhaps try to do this, but maybe, like you said, you don't have to, you may not be able to, but if you do, are there
yeah.
some things that you probably shouldn't eat before?
Um, yeah. I mean, maybe I think so. I mean, I think those, the,
I
I think
throw up all
those are,
over.
well, you may, yeah. I mean, if you have a gag reflex, that does induce nausea or something like that, but yeah, probably not.
Yeah.
Um, I think what you want to be able to do is just to kind of know what feels good to him and what feels good to you. The precautions that I would take,
Mm-hmm.
is not going too fast.
Right.
And like you want to know, if if you don't have to, swallow, like when he can tell you when he's going to ejaculate as best as he can, but he does not need, an ejaculation to for a blowjob to be enjoyable. And so like that would be nice, but like that's not something that you have to do. So you probably just want to know if that's something that you're comfortable with, or if you're not comfortable with. Um, I think those are the main things. Your jaw can become tired,
Mm-hmm.
depending on how long you're going. So you want to be able to like know that you can take breaks, and to relax your jaw, and it doesn't have to be like one extended, fellatio session. Like you can, break it up into parts so um, it's not tiring. And again, you don't have to go all the way to orgasm for him for it to be for it to be enjoyable.
That's right. That's those baby steps, right? Just,
Baby steps, yeah.
any step toward. Yeah. Yeah. So is there anything else that you can think of? Like I said, I know I kind of took an abrupt turn there. We started out by
Oh,
talking
that's
about
okay.
your counseling and what you do, and talking about marriages that kind of have some blockages and they become disconnected. And I mean, I just really wish that there was some kind of red flag sign that could kind of come up and say, okay, danger, danger, danger. You need to help couples
Yeah.
before they become so far apart. And
Oh, yeah.
so I guess for me,
Yeah.
the main reason for having the show and having you on is to just kind of,
Yeah.
gosh, I wish people could kind of check themselves before they get to the point where, they really
Yeah.
need a whole lot of help. Of course, we still want to have help from you, Dr. Matthews, but,
Oh, yeah.
but,
Yeah, I mean, I think the red flags for me, like lack of oral sex is not
no,
necessarily a red
no,
flag.
yes, I get it. Yeah.
What is the red flag is more so that, you feel yourself kind of pulling back from each other
Right.
through in the sexual relationship, where you're not sharing with each other, you're not experimenting, you're not talking, like you're not, those type of things. If you, I mean, if you're not having sex, I mean that's a big red flag.
Yeah.
But if it, the kind of the precursor to that step is that you stop really communicating fully about it, and it starts to become more of a resentful thing, and something that you don't feel like you can share what you're thinking with your spouse. It doesn't feel safe anymore to begin to even talk about what's going on in your sexual relationship.
Right.
And so that to me is kind of that would be my red flag. Say, get into therapy, start having somebody. The main thing a therapist can do for you is really just help you start talking about these things and communicating in a way that's helpful, instead of communicating in a way that's hurtful, and
Right.
that makes the problem worse, but
Yeah.
rather than better.
Yeah. I just want to try to improve people's relationships, help them
Yeah,
along. One other
that's
thing
so
that
awesome.
that I found was very interesting that you were saying was this thought of admiration and respect for the person when they're doing, what we were talking about with fellatio. And I thought it was interesting because I was listening to an interview with, it was an old interview. Oprah was talking to a bunch of men who had strayed from their marriage and they went out and cheated. And
Uh,
it was interesting because some of the feedback that they were giving, as far as what they were getting from the other woman, was just what you were saying, this admiration and this they felt respected and like this person was just really enamored with them. And it was almost kind of the same thing you were saying that men get from women doing their partner doing this. It was almost the same thing that they were saying that they were getting from somebody else. So I thought that was kind of interesting. as you were talking about it. So
I'm sorry, I missed that last piece.
I
Can you say that one more time?
I was just saying, I
I'm sorry.
thought it was kind of interesting how the parallels to, when men were talking about another woman when they strayed from their marriage,
Oh,
they talked about
yeah.
how oftentimes the other woman had this admiration for them and this respect and
Oh, yeah.
just, they just
Yeah, 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 yeah.
adored them. And so it was interesting as you were talking about the fellatio and how important it is to a man to have their wife
Yeah,
or their spouse do this or their partner. You were talking about those same things, this deep
yeah.
admiration and respect. And so I thought that was kind of, I don't know, that was kind of an
Yeah,
aha moment. I was making a connection there. And it's
yeah.
like, okay, so if we can
Yeah,
do some of this stuff, then you don't, perhaps maybe this person doesn't, stray or whatever. I don't know.
yeah.
It's just something I was
Yeah,
thinking.
I mean, that's a big thing. I mean, that feeling. I mean, yeah, that for sure. Oral sex does that and helps improve by those feelings. But that is a common complaint is that when there's an affair happening, and even when there's not an affair,
Right.
when marriages are kind of going south, the male partner, not always, but a lot of times will just the main feeling that'll come out is that I can't do anything right.
Yeah.
I'm failing at this, and that doesn't mean that they're not doing anything wrong. I'd be clear about that. Like, both people are contributing to this, but from that side of things, like that feeling of I can't do anything right, all of my efforts go unnoticed in the relationship, right? I don't get nothing I do, none of the good stuff that I do is getting recognized. Like that becomes a really tough place for somebody to kind of exist in, and so that feeling of being admired and respected and cared about and connected to your partner, all of that goes into that,
Yeah.
and that becomes super important as
It's
well.
hugely important. Yeah. Okay, so can you tell the listeners, how can they hear more from you? I mean, do you write
Yeah.
articles? I know you've got the
Hmm.
website, and people can go on that website. You used to be on
Yeah.
the show,
So
but you're
we
not
have,
anymore. So yeah, well, how can they hear from you?
yeah, I had to step away from the podcast, but they can, we have a blog where I contribute to. I post videos. We just shot another one today, and we have on there, and they can um, get information there. We post some links that we love every week, just kind of a roundup, and we're also posting articles about some common things that we're seeing through therapy. And then they can also follow us on Facebook at Matthews Counseling. Matthews is with plenty, or on Instagram at Matthews Counseling on there as well.
Yeah.
And that's where we just kind of get stuff. And then we have the biggest thing that is we have our Love and Sex 360 retreat that's coming up in November. And that is we have three different couples therapists with me we all have a combined experience of more than 60 years doing this work. And we just saw that there was not a marriage retreat that had a sexual component as well,
Mm,
or that was being done by licensed counselors and marriage therapists.
all right.
And so if you go to Love and Sex 360, the number 360.com, that's where we just actually opened registration on Valentine's Day this past Valentine's Day. So,
Great.
and there's an early bird discount for it. They can come and get over 12 hours of workshops where we kind of break down marriage and understanding marriage. And then there's also an option to add on to that some private one-on-one couples therapy with one of our therapists so they can connect with me that way. We're going to be, it's in Asheville, which I don't know if you've ever been to Asheville, North Carolina, but it is a beautiful, beautiful
Is
place.
it?
Then,
Wow.
oh my goodness, it's gorgeous. It's in the Great Smoky Mountains, and it is just, it's gorgeous out there. And so we
Nice.
make sure to have time for couples to kind of get out and explore and be together,
Oh,
going to the Biltmore, going hiking, or there's tons of breweries there as well. So,
wow.
it's just a wonderful place. So anybody that wants to be there, we would love to have them
Sounds
as
really,
well.
really nice. Sounds really nice. Well, thank you so much, Adam, for coming on the show. I can assure you I'm going to be calling you again because I want to have you
Oh
back.
yeah,
I want to have
I'd
you
love it.
back.
I would
Yeah,
love it.
yeah. male menopause. I want you to come and talk about that. I saw
About
that.
male menopause.
Yeah,
Oh,
yeah,
yeah. Okay.
yeah. So
Yeah,
let's
we can talk about that. That'd be so fun.
All
Thank you
right.
so much for having me, Tina.
Yes, thank you. Well, everybody, I hope that you've enjoyed listening to the Lovers Lounge podcast, where we interview experts and other guests on topics related to love, relationships, and sex. I am your host, Tina Love, and until next time, peace. And of course,